morning, everyone. Can I start? So I'm Dr.
Finalist from yesterday's talk.
So today I'm going to present my paper on the tick and eye diseases. So objective is to study the ocular manifestations and the complications following a tick bite. So I analyzed all the cases that presented to us with tick bite during the monsoon seasons in South India. All these patients were residents of Kerala. We did a detailed ocular evaluation, IOP, fundus evaluation, and all these patients were called up on frequent intervals to monitor for systemic manifestation. A liaison with a local physician and a microbiologist was created to refer, treat, and to follow up these patients. So the primary outcome was to study the ocular manifestations following tick bite, and the secondary outcome was to find the chances of development of systemic manifestations and also to find the efficacy of prophylactic antibiotics in preventing the complications. So we had 23 eyes of 23 patients, all were unilateral presentation. We found that the higher incidence is during monsoon season because it's their breeding season, and the best corrected visual acuity of our study population ranged from 2020 to 2000. The mean age was 47 years. Tick was present in situ in 13 eyes, and out of that it was live and still alive when we have taken out in 10 cases. Period of presentation after the tick bite was a mean of 4.9 days. Associated fever was present in 7 cases, and the mean period of development of fever was 7 days. Most common symptom was eyelid pain. Most common sign was eyelid edema. 10 patients attempted self-removal of the ticks. Non-granulomatous anterior uveitis was present in 5 cases, and the mean period of development of uveitis was 11 days. One case which presented like a conjunctival nodule actually had a dead tick embedded and concealed. This case had severe uveitis. Prophylactic antibiotics were taken in 16 eyes. 5 eyes which presented with uveitis and 4 cases which had retinal involvement actually had not taken antibiotics and were started later. One patient, a 78-year-old male, presented with uveitis, vitritis, and macular edema, actually had parts of the head recovered from the eyelid nodule with surrounding ulceration, and that was concealed. So these are some of the pictures of our patients, and 2 cases actually had severe cellulitis, but they were actually also having uncontrolled diabetes. Species identification was possible only in 11 eyes. The most common species was Ixodes in our case, but what we noticed was whenever it was dog tick, that is a dermacenter variant, almost always it led to fever. 4 cases had retinal findings, 2 had only disc edema, 2 had typical neuritis, retinitis like picture. They had also had associated myalgia and mild fever 2 days prior to the onset of the defective vision. Visual acuity had dropped to 20/60 in the first case and 20/100 in the second case. They were sent to the physician. He started them on tab doxycycline along with rifampicin and low-dose steroids. And the steroids were tapered very slowly. So ticks, as we know, are ectoparasites and then can cause serious and life-threatening diseases. Mostly these are reported from US and Europe, but it is not uncommon here. Actually, it is underreported. And why? Because it is because of the low clinical awareness and easily gets overlooked. Serological testing actually has a limited role because it can be negative in the initial few weeks. Hyaloma species and Haemaphysalis species are common in India. And why do these prefer the lids? They habitually enroute the meibomian gland and present like a mass that mimics a hemangioma or a nevus. And the preferential localization is due to the fondness of the tick to warm and moist environment, which is easily available in Kerala. And also because of the eyelash that have cilia, they can easily travel to the lashes, and inhabitation leads to detection very impossible. And how it gets its bloody meal? It secretes some cementing substances and it releases anticoagulants through which it gets a continuous blood meal. So there are so many ocular manifestations possible, and how to remove. Whenever you are removing, you have to use a blunt medium tip forceps, otherwise they can release its potential infectious substances and can lead to complications. So to conclude, most common site in our cases was near the lashes, most common symptom was eyelid pain, and most common sign was eyelid edema. Incidence of systemic manifestation was less, but more with dog tick bite. Posterior segmentic involvement was less in our study population, maybe because almost everybody had taken prophylaxis, because in Kerala tick bite is very common and we have endemic diseases. And it is advisable, so we advise it is better to start at a prophylactic doxycycline in all cases, since the chance of development or complication is still unpredictable.